Can contrast dye cause allergic reactions during a cancer court scan? Imagine sitting in a hospital room, waiting for your scan, feeling a bit anxious about what's coming next. You might have heard about contrast dye and wondered if it's safe. Well, let's explore what contrast dye is and whether it can cause allergic reactions during a cancer computed tomography scan. Contrast dye, also called contrast material, is a special liquid injected into your vein. Its job is to make certain tissues or blood vessels stand out more clearly on the scan images. For cancer patients, this helps doctors see tumors better, check how treatments are working, or guide biopsies. The most common type used in court scans is iodine-based. Now, most people tolerate contrast dye well, but some might experience reactions. These reactions can be mild, moderate, or very rare but serious. Mild reactions include feeling warm, a metallic taste in your mouth, nausea, itching, or a mild rash. These usually go away quickly and don't need treatment. Moderate reactions might involve a more intense rash, hives, vomiting, or mild trouble breathing. Sometimes medication can help resolve these symptoms. Severe reactions are very rare but can be dangerous. They include difficulty breathing, swelling of the throat or face, very low blood pressure, or even loss of consciousness. If you've had a reaction before, your risk of having another one is higher. But even if you've never reacted to contrast dye, reactions can still happen because they are unpredictable. For people living with cancer, who often have multiple scans over time, repeated exposure to contrast dye is common. This doesn't necessarily mean your risk increases, but it's important to tell your healthcare team about any past reactions. They can take steps to reduce your chances of a reaction, like giving you medications before the scan or choosing a different imaging method. Kidney function is another thing to consider because some contrast dyes can affect the kidneys, especially if you already have kidney problems. Your doctor might check your kidney health before the scan. Having allergies to other substances like shellfish doesn't automatically mean you'll react to contrast dye. That's a common myth. Also, certain cancer treatments or medications might interact with contrast dye, so sharing your full medication list with your care team is always a good idea. If you're worried about reactions, always tell your healthcare team about any allergies or past issues with contrast dye. They can answer your questions and help you weigh the benefits of the scan against the small risk of a reaction. Remember, your medical team is prepared to handle reactions quickly if they happen. While reactions are possible, they are usually mild and manageable. The main goal of using contrast dye is to give your doctors clearer images, which helps in your diagnosis and treatment. So, if you're scheduled for a cancer court scan with contrast, don't hesitate to discuss your concerns with your doctor. They're there to support you and make sure your experience is as safe and comfortable as possible.